Okay, thank you. My name is Neil Bendel. I'm a public health specialist in the public health department of Manchester City Council. I head up the knowledge intelligence team. My colleague Amanda Dixon, who's the programme lead for knowledge intelligence in the team. And we're going to try to answer the question of are we making Manchester fairer, and describe some of the work we've done in terms of attempting to monitor and change the way we think about health inequalities in Manchester.
So the pandemic exposed sorry, let me start again. I'm really nervous, so apologies if I'm a little bit stumbly today. So the pandemic exposed health inequalities in England and exacerbated them, as we've heard in the previous presentation, with people from Black and minority ethnic backgrounds experiencing a greater risk and greater harms and impacts from the virus. Professor Sir Michael Marmot and the Institute of Health Equity produced a report on this called Build Back Fairer, which covered inequalities in the death rates that were experienced, how different groups were affected, the impact of containment measures and how that was different, and what can be done to build back fairer from the pandemic. So this is the basis for Manchester's response and how we're recovering from the pandemic through a piece of work that we've titled Making Manchester Fairer. Manchester is a large and diverse city. We've got an increasing population. The local authority bit itself is only one of the 10 local authorities that make up Greater Manchester as a region. Manchester itself is the most densely populated part of the northwest. Deprivation is widespread across the city, but there are notable pockets of deprivation towards the north and the east sides of Manchester. We're the 6th most deprived local authority in England, and 44.7% of children are estimated to be living in poverty in the city, with 7 in 10 of those children living in families where there is one person working. So in-work poverty is a real issue for us. So Making Manchester Fairer is our local response to building back fairer. We've published an action plan detailing our ambitions, setting out our programme of work, and that's focusing on 8 key themes. So we expanded on the 6 themes that were set out in Build Back Fairer. We've made them more Manchesterised, as we always do in Manchester. So because we experience slightly different issues than the kind of national picture, we've got our own bespoke theme around tackling systemic racism and discrimination, which has been picked up by Professor Sir Michael Marmot as well and been incorporated into more recent work that he's been talking about in relation to inequality. And we've also split out a particular theme to make sure that housing was covered as its own separate theme, because we've got particular issues in Manchester around our housing stock and the needs of the population. The City Council is overseeing the programme board for Making Manchester Fairer, but it is truly a cross-organisational programme of work. So we've got a theme leads identified from across the public sector. They're taking ownership of areas where they're more experienced and are best placed to lead on those particular themes. We've convened an inequalities data development group, which is bringing together intelligence specialists and analysts from across the partnership, and we're working to join up work around measuring and monitoring inequality. We're trying to build an inequality lens into the products and tools and processes that we use, and working to track changes in inequality over time as well, in a more regular and robust way than we have done in the past. Through the Inequalities Data Development Group, we're trying to drive a reduction in inequality by starting to influence more equitable delivery of service. And we're having some difficult conversations as part of that about how do you balance the needs of the entire population against putting more resources into groups that could potentially benefit more than increased resources, because ultimately we've got a finite amount of resources, and how we deliver them in a more equitable way. There is no right way of doing it. It's about having that discussion about how we can make it more fair. So in terms of measuring and monitoring progress on reducing inequality, we started with the 24 beacon indicators that were in the Build Back Fairer report from Professor Sir Michael Marmot. And we've had a look at what we can do in Manchester that is slightly different. So we're ensuring that particular Manchester issues are covered. So, for example, one of the indicators that we've proposed in Manchester is around organisations paying the real living wage. We've identified that is a particular issue in Manchester when you've got the 3rd highest proportion of children living in poverty, where they've got one parent who is in work or one person at home who is in work. So that's a particular issue and indicator that we're using in Manchester that's slightly different from the Beacon indicators. You'll also note we've got in our systemic and structural racism and discrimination theme, we've taken it back a step as well to think about how we improve data collection. So that is in services in terms of primary care and secondary care, in terms of are we collecting information on protected characteristics, ethnicity, that kind of thing. But also around our diversity of our workforce as well, because we need to be leading by example in terms of making sure that the people who are making the decisions across the health and care sector in Manchester need to reflect who that population is, because if they're not, then they're not fully understanding what experiences those population groups have. There are some limitations as well around some of the indicators and themes around frequency of reporting and monitoring. We think also there are issues around the availability of local data. So when we had a look at the initial Beacon indicators, we felt that some of them we wouldn't be able to get local level data. So that's why we've had to Manchesterize it as well, to encounter, to work with the data that we've got access to or can work towards getting access to as well. And we've got a limitation around can we say that we can affect change over the period of time that the programme of work is over? So some of what we're trying to strive for is going to take decades. That is seen through where we've looked at things in Manchester where we've done really well. So teenage pregnancy, a lot of work has gone into reducing numbers of teenage pregnancy, and it took a long time to start seeing the trend reduce on that. And then it's taken a longer period of time to get it to a level where we're more similar to the national average. So given that programmes of work like this are finite in time, we're thinking about how can we set this up to be ongoing in the future, and embedding some of the changes that we're proposing in terms of measuring and monitoring inequality for the future, not just over the time of the Making Manchester Fairer programme of work. So in terms of measuring inequality, we've got historic reports going back years. Neil has got a drawer that has got tons of inequality focused reports going back a number of years now. But if you actually look at historical evidence, you can date it back to the 1840s when Marx and Engels were talking about the slums of Manchester. So we've never cracked it, the issue of inequality in Manchester, and I don't think we're going to crack it in the next decade. It's about how do we make progress on the journey towards improving things. What we have found though, when we've looked back at those reports, they're all based on kind of points in time, and we've been less effective at kind of tracking the changes more routinely and tracking it over time. We found that existing performance reporting locally doesn't really have sufficient oversight of changes in inequality. So it is sometimes masking where improvements haven't been made. So you might find that an outcome metric overall has improved over time, but when you look at differences between groups of the population underneath that, I'll show you an example soon where we've actually not narrowed the gap for a particular population group. So what we're trying to do in Manchester is try new things and do things differently. We're developing this approach, and we're challenging the way we've always done things. We're being challenged basically to progress our thinking, the tools that we use, how we work together, the way we communicate with each other, and most importantly, how we communicate with the public. So our approach can be broken down into 5 different elements. So firstly, we need to understand what the key issues are and key inequalities are. We need to keep our work focused on measuring and monitoring key inequalities rather than trying to deliver detail on everything, because that would result in information overload. So we are keeping very, very focused on what key inequalities are, and we're trying to be led by that on the expertise of people who work in particular sectors as well, to tell us what the key inequalities are for the populations that they work with. We aim to build on what we currently have as well, so we're keeping a focus on overall outcome metrics, but we're trying to bring in additional information around gap metrics and inequalities, where those key inequalities may have changed over time. We want to get that built into routine performance reporting as well. So there's a bit of a learning curve for senior managers who may have never seen this information before about how we skill them up to understand what inequality and gap metrics look like, and get that embedded as well. We've convened an inequalities data development group. We're commissioning so the inequalities data development group are trying to commission a measuring inequalities toolkit with the University of Manchester, who are helping us to basically support analysts across the partnership about the best methodologies to use, presenting inequality measures in a better and improved way, agreeing and standardising methodologies for reporting inequality gaps between areas and groups of people. So just trying to skill up our analytics community. We're also trying to bring along policymakers on that journey as well, so that it's not just for analysts, and that we're trying to influence the senior leaders as well. So this, as I've mentioned, is the example of how to measure progress on outcomes compared to progress on inequality. This is from the Office of Health Improvement and Disparities Health Inequalities dashboard, which I found really helpful. So the dashboard itself, it uses different statistical techniques such as absolute and relative gap and slope index to present key health inequalities. The example here is on school readiness. So this is the years preceding 2018-19. I've not gone any further than that on this data source for the reasons of the pandemic has made things not necessarily comparable going forward. But you can see in the leftmost chart that the number of children who weren't ready for school has reduced. We've made an improvement over time to 2018-19. However, if you look at the difference between children who were eligible for free school meals, which we're using as a proxy for socioeconomic inequality, and those who weren't eligible for receiving free school meals, you'll see that the gap actually hasn't changed very much at all. What we're doing here is making that link then between the socioeconomic inequality and the poorer outcomes for children. So the intention is to use this to target some work at those children who are most in need and having those poorest outcomes to hopefully narrow the gap to their peers' outcomes. We've got an ambition to produce an annual temperature check of progress against actions in the plan. So like I mentioned before, progressing on from the Build Back Better beacon indicators into something more focused on the work that we're doing in Manchester. We don't want an additional dashboard for managers and leaders to have to digest. They're just simply not going to do that. So what we're trying to do is bolt this onto other pieces of work that already exist. So we produce an annual State of the City report for Manchester. Our intention is to have a State of Inequalities report or product that accompanies that focuses more on the inequality and gap metrics. We recognise, this is the last slide now, we recognise that this is an ambitious and complex piece of work. It's needing significant changes to how we work and how we communicate, and it is a bit of a journey. So it's not going to happen overnight. And like I mentioned, we need to bring senior leaders on this journey with us. We need to be persistent and keep restating our approach and give it time to embed the changes. We know that the high-level metrics don't encompass everything that we're trying to deliver, but as we said from the start, we're measuring what is the most meaningful so that we don't risk information overload. The targeted work that's coming out from the programme is, we're calling those kickstarters, and those are kind of quite small defined pieces of work. They're very small in scale, but we're hoping that they're big in impact. And what I've not covered in this presentation is the fact that that impact is perhaps not best served by quantitative data. So we're trying to bring in qualitative data as well about the benefits that the people who are experiencing that targeted intervention find from the intervention itself. We know we're going to have to revise some of the metrics as data and reporting develops and advances. And as I've said, we view it as a journey from quite a basic starting point to something more mature as a system. Yeah, that's it. I don't think there's anything else I've missed. If you do want to contact us for any more information, or you want a copy of the slides, that's our contact information. Thank you very much for listening to me, and if anybody has any questions.
Are there any questions for Neil or Amanda?
Well, thank you very much. Balance the politically motivated for these kind of
Yeah, I don't think we've got that far, have we, in terms of speaking to the political aspects of the organisation. I think we're starting with the workforce who deal with kind of on the ground stuff before we start bringing them. We do have we've had some appetite, haven't we, from councillors?
Yeah, and I
So
think
the programme board is led by one of our
in terms of the programme as a whole, it is at the highest level of the council. Our chief executive and our, in fact, the leader of the council are both heavily involved. This is one of the top priorities for the council, and through the governance structures, those individuals chair some of the key groups. So it is very, in terms of the programme as a whole, absolutely got the highest level of political backing. In terms of some of the data, particularly asking that what's a difficult question in terms of, as Amanda has shown, have we as a city been as successful as we have been saying we are? So, you know, if we improve outcomes overall but haven't reduced inequalities, what does that tell us as a city in terms of how well we've been doing? That's the sort of difficult question that I suppose we'll have to kind of people will have to start thinking about once we start presenting this data to them, which is why embedding it within routine performance reports, which go to senior managers teams anyway, is the way that we're trying to kind of get those kind of questions asked, and not make it something different, but kind of embed it into the warp and weft of the performance reporting process of the council and our NHS colleagues as well.